Democrats, meanwhile, are pouncing on that CBO score that says under the House plan alone, 23 million will be left without insurance. So Fox Business's Gerri Willis, former DNC Deputy Press Secretary Jose Aristimuno, and GOP fundraiser Noelle Nikpour. Gerri, explain this. Now, we know about 12 million have Obamacare, the Affordable Care Act now, so how can 24 million be effective? Was this based on a 10-year horizon that 24 million fewer will have it as a result of the Republican plan than would otherwise be the case?
That's absolutely right. You got it right there, Neil. So what they're doing is comparing it to a baseline of how many people would be enrolled and or not have coverage if Obamacare continued. That's the comparison they're making. But let me tell you, they don't have a great track record on this, as we've discussed. Originally, CBO said that Obamacare would enroll 22 million people. It's only enrolled 11 million people. So when it comes to enrollments, the track record here is not too good. And if you read their report, they've even got a disclaimer in this. I just want to read a quick sentence out of the report, which says this: the ways in which federal agencies, states, insurers, employers, individuals, doctors, and hospitals would respond to the changes made by the legislation are all difficult to predict. So the estimates discussed in this document are what? They say they're uncertain.
Amazing. All right, Jose. Now, I don't know how the CBO puts things together. They're the only game in town, so I'll accept that. There's only so much you can do with the data you have, and things change. I understand that. But left out of this argument is that the deficit would also shrink more than it otherwise would, by almost $400 billion over 10 years. I don't put much stock in any of these numbers, but that story has not gotten out there. But what do you make of what happens now with the health care push?
Look, the deficit is certainly important, but the health of Americans is much more important. Look, I just can't understand how the Republicans and President Trump celebrated at the White House that the House bill got passed, and he hasn't even passed the Senate. So what are you celebrating? Are you celebrating that you're going to lose millions of Americans could potentially lose coverage?
Wait a minute, Jose. I'm sure you weren't personally among those who were blasting Republicans when they failed and they pulled their first health care rework effort in the House. Back then, it seemed to be vitally important to point that out. The president winning one in the House before it goes to the Senate, not so much.
Look, they should have waited. They should have waited for the CBO score to come out before they started sort of shoving that bill through the House. Now, let's see what the Senate's going to come out with. I'm sure, you know, let's wait and see what happens.
Right.
Look, we want to work with them, but you guys got to give us something that...
You don't want to work with them.
Come on.
Come on. You're almost like that French leader now. Noelle, I'm just kidding. But, Noelle, when I hear and see this type of thing, and I know each party plays the game, if the CBO numbers support their strategy, they love it. If it doesn't, they don't. But having said that, these things are really hard to predict, especially knowing how many will be covered, to Gerri Willis's point, 10 years from now. You're trying to prove a trend that is specious to begin with reverses itself that dramatically in 10 years, right?
You're absolutely right. And the CBO, does anyone really trust these numbers? You know, Gerri had it right when she gave those facts about the 22 million that were going to sign up, and it was an actual 10 million. And to go a step further, you know, we've got, remember the small business exchange under Obamacare, where 4 million people, the CBO said, would sign up, when actual it was about 233,000 people, and that's pretty way off. So I don't think anybody really cares or gives a hoot about the CBO numbers, because I don't really think, you know, the score really affects them. And what I will tell you, what I find really strange is that the co-chairman from the DNC, Mr. Keith Ellison, is telling everybody to run on a single-payer tax system for 2018. So they have already pounced on these crazy CBO score numbers, and they're telling their people that are going to be running for office to run on a single-payer position.
All right, guys, thank you very much.